If you suffer from persistent, moderate to severe chronic pain, or have become dependent on opioid drugs, and when alternative treatment options are inadequate and you can't live the life you used to, there is something. Ask your doctor about methadone. Methadone is classified therapeutically as an opioid analgesic and pharmacologically as an opioid agonist. Methadone is also used for cancer-related pain in opioid-tolerant patients who need daily, around-the-clock, long-term opioid treatment. It can also be used to treat opioid dependence, meaning opioid detoxification and opioid addiction maintenance.
Methadone is absorbed from all sites. It is widely distributed. It can cross the placenta and enter breast milk. Methadone has high protein binding. It is mostly metabolized by the liver. Some metabolites are active and accumulate with chronic use. Methadone's half-life is 15 to 25 hours and increases with chronic use. It passes the blood-brain barrier and enters the central nervous system.
Methadone binds to opiate receptors in the central nervous system. The primary mechanism of action is as an agonist at opioid receptors. However, it also acts as an antagonist at NMDA or glutamate receptors. In the simplest sense, it inhibits the ascending pathway, which transmits pain signals to the brain, while activating the descending pathways to stop pain perception. Therefore, overall, it alters the perception and response to painful stimuli and causes generalized central nervous system depression. Methadone can improve your symptoms. If you're taking it for addiction, methadone will provide enough stimulation of the opioid receptors to reduce cravings for and the effectiveness of other opioid drugs. Methadone also prevents withdrawal symptoms because, unlike other opioids, methadone has a long duration and only needs to be administered once a day. And due to how methadone is administered, there is dose control, and the risk of overdose and blood-borne diseases are much lower. And if taking methadone for pain, it has analgesic properties to keep that pain under control.
Take methadone as prescribed only. Do not crush extended-release drugs like methadone, as it can cause oversedation, respiratory distress, or even death due to the rapid absorption of the drug. A larger dose of methadone or a change in the frequency of administration may be needed to treat breakthrough pain. Abrupt discontinuation of this drug can lead to withdrawal symptoms. Do not take methadone if you are allergic to it. Avoid using alcohol or cannabis with methadone, as it can cause you to become more dizzy or drowsy. Operating machinery should be avoided in this situation. If you are pregnant, only use methadone if instructed by the doctor. Be aware that methadone can be passed through breast milk. Common side effects are confusion, sedation, dizziness, dysphoria, euphoria, hallucinations, headaches, hypotension, bradycardia, cardiac dysrhythmias, flushing and sweating, blurred vision, and diplopia, adrenal insufficiencies, constipation, nausea, vomiting, urinary retention, respiratory depression, physical dependence, tolerance, psychological dependence. Talk to your doctor about taking methadone so you can go back to all the things that you love doing.